article online shared about this, what I wish someone told me before I become a nurse. Now, do you want to know? We have 4 incredible nurses here joining us on the show to share their stories. So please welcome Jazrina Kaur Sidhu, who is a nurse at the cardiac ward, Ara DamansaraMedical Centre. We also have Normilia Anida Zulkifli, nurse from the surgical and medical ward of Parkcity Medical Centre. Now, from the intensive care unit and neonate intensive care unit of Subang Jaya Medical Centre, we have the nurse manager, Andrea Wong, as well as Arthur Lim, who is a nurse himself. Now, good morning, ladies and gentlemen.
Hi.
Good morning.
Happy Nurse Day.
Thank you.
So aren't you glad that there is a day to kind of commemorate your contributions in this world?
Yes.
Now, tell us, what made you, decide to become a nurse, Wong?
Nurse is never my first choice, but it's a calling. You know, when I joined into the nursing, then I realized, how wonderful, the nursing job life can be, and it's just not, I learning and working along it, and I truly get blessed by the rewarding of the job.
Wow, wow, like Florence Nightingale herself, really. That's why she chose to really give back. For you, Arthur, now in the nursing profession, it's very rare that we see, male nurses helming the role. So, for you, what made you decide?
I guess it's the passion, being thorn among the roses for some special occasions, The question can also be directed, asking a female why a female wants to be an engineer.
Right.
Yes.
Right.
That's
So,
true.
True, yeah.
For a male to be a nurse, why not?
So your parents, your family were very supportive of you becoming a nurse?
Yes, definitely. I have a very supportive family, I must say. Thank my mom and my parents for supporting me, as well as my aunt, because she's also a nurse in HDU and she's currently practicing in Australia.
I see.
Yeah.
Okay, so you have an inspirational role model, really.
Yeah.
Jazrina, what made you take up this profession?
Okay, there was nothing that I wanted to do it of my own.
Okay.
But I was suggested by some of my family, my friends and everybody, because my cousins are also nurses. My uncle, who's a doctor.
I see.
So they were saying, okay, go along nursing, it's going to be good. So we went upon it and it's really good. Right now, I think there's no other profession that can make me the best. Than nursing.
Wow.
Yes.
And Normilia, for you, what is a job of a nurse like?
Well, for me, it's kind of like frustration. Still,
A lot of frustration?
yeah, but still, at the end of the day, I feel glad to be a nurse because we care of patients and we take care of them like our own family.
Okay, so you talked about, now you touched on frustrations.
Yeah.
So what are the frustrations that you encounter?
Well, sometimes we're being nice, but there is, kind of like unsatisfied from the patients, But for me, it's a life.
Okay.
It's a life of a nurse.
Right. Now, we see a lot of dramas. You've got Nurse Jackie, who's like a hit series, and a lot of medical dramas.
Right.
Is it very much like what you encounter in your workplace? How can a crazy day be, Andrea?
It can be very crazy, when you sometimes, like when you just finish and taking over a report, there goes the code blue, there's come the call bells, the patient is calling, and then the doctor is coming in for his round, and it's just like all over the place. We are so multitask yet,
Yeah,
I'm just so proud with my team of nurses. They can like so many hands and legs on them that they can just gather everything, and yet they can just tell the doctors what is going on.
Wow, okay, this must come from, I don't know, experience. But what would a situation be described as a code blue?
Code blue is like at any situation when the patient, in a collapse step, probably they stop breathing or their heart stop beating.
Oh.
Then we'll sort of like call for an emergency response from the hospital.
Okay, all right. And for you, Jasrina, I mean, what can like something, you know, like a day that's really overwhelming be like?
Okay, that's the same like what Miss Andrea said, but actually it can be very, very hectic because like we just came on board, just came on duty, and there'll be so many things calling around. Sometimes work carried over till the noon shift and all. Patients, they have got a lot of investigations to do to make sure their condition is going well and everything. So we have to get that done. We have to get the doctor sorted to see the patients, to make sure everything, medications given on time, patients are seen by us first before we progress to the doctor. So there's a lot of things we have to make sure it's done before we actually put it to the doctor. So we have to be very,
Now we see our nurse Jackie, I mean, her life it's totally mad in the, you know, in the hospital. You know, do you get to even have lunch, or you know, it's sometimes like mealtime skipped?
Yeah, skipped.
Yes,
I think
always.
breakfast.
Most of the time, I guess. Most of the time.
Sometimes you just have to hold your bladder
you just
also.
forgot
You can't move
that.
Oh, even your toilet visits.
you cannot. You just have to wait because like sometimes you're like, okay, I'm going to see this patient first. That can be later, you know. So you'll tend to just keep.
You tend to drag the time with the patient as well.
Exactly. Yeah.
Okay. Now, how? What is it like dealing with patients? Because you know you obviously have patients of various personalities, right, Andrea?
Yeah, we sometimes do encounter patients, like for example, those who, how to say, not to say they're demanding, but we understand their expectations and their needs lah. So we always try to put ourselves in their shoes and understand them. Then only we're able to really deliver a care that, you know, that's comfortable to them.
Okay, so you obviously have to deal with the patient as well as their family members, right? Yes. So how do you fathom this, Jasrina?
Okay, normally while we're in the wards, we actually have to explain our care to the patient and also the family members. Sometimes if they are not around, and then like patients, they can't really take it when you tell them something, because they're actually very in their different sort of mood and very agitated because they're not well.
Yes.
So they won't be able to take it like, you know, in an understanding way that, okay, this has to be done and this has to be done. And there's a reason why it has to be done. Like, for instance, we just go and ask them, okay, uncle, what did you have for breakfast today? We need to jot it down, and we need to know how much you pass urine and everything. So they will be like, why you need to know all that? They'll get like, I need to pass urine, I need to pass urine, why do you need to know? But there's like so many other things, because in cardiac, we're actually looking at the heart, so we don't want the fluid to be overloaded.
Right.
So there's an importance. So once the family members comes, we explain to them, then they will also give some assurance to the patient.
Right.
That's how we go along.
With cranky patients, or you know, because as you pointed out, you know, people who are in the ward who are ill, hospitalized, they may not be in their best form, right? So you don't see the best sides at times. Now, how do you put up with it? I mean, can it be really stressful for you?
It will definitely be stressful. Yes. I guess this is the challenge of every nurse that is there.
Because sometimes we are also tired. We are also like, you know, we have got a lot of things to do, so we are like thinking about so many other things. So, but we just try to be patient, listen to them first what they are trying to say. Sometimes it's just that very little thing that we can just do it, okay, just for a while. So it's okay, then they'll be at ease also. So once they're at ease, then we can be at ease.
Right. So you have to practice some skills. I mean, obviously, this is interpersonal skills, right, Nur Amelia?
Yeah, true.
What was the worst kind of patient, without naming names, obviously, but what was the worst scenario that you had to go through?
Well, for me, there is you know, some kind of like they have to wait for the discharge, and sometimes when they have to admit also they have to wait for you know, empty beds, you know, and sometimes when they come happily and then they have to wait and wait and wait, so they kind of like frustration, and when they come to ward, they kind of like, you know, they expect more from us actually. So they tends to be angry at us, but we, you know, same like Jasrina said, we have to listen to them and then comfort them, so that they will be at ease.
No, I do feel a level of empathy and sympathy because when people come to the hospital, no matter a patient or the family, you know, it is a very stressful situation. Obviously, someone is warded or someone is unwell, and so you know your stress level for anybody visiting there is always high. So you're always on the edge, right? Now, some people say that, you know, nurses, and this was commented on our Facebook by one of our viewers, saying that you know some nurses that she encountered were a little bit desensitized. You know, like you know, it was like a little bit insensitive towards the needs of, you know, patients and the family. I mean, what are your thoughts on this, Andrea?
I do agree, you know, because sometimes the amount of workload that is on a nurse is so much that the nurse is just focusing, can I quickly get this thing done, the results in, and you know, probably the patient need to be prepared for a procedure and things. You know, it's all in her that, you know, she at times may overlook the needs of that patients, probably the emotional support.
We'll get sidetracked at times.
Yeah,
You'll get sidetracked
at times,
because your job is overwhelming. It's just not one patient.
Apparently, a nurse is everything. I guess all the nurses will be saying that we are not just nurses. We can be housekeepers. We can be IT experts. We may be engineers. We may be everything. I mean, a nurse is everything. Now in the Malaysian healthcare sector, we are doing practically everything for the doctors, for the nurses, and of course the patients and our associates.
Okay. All right, we're going to take a quick break, and when we come back, we're going to find out more about our nurses' professions and what is a day like in their hectic, crazy life. Celebrating International Nurse Day, and so we have 4 nurses here in the house to talk about their profession. Jasrina, tell us, you know, with nurses, every day, every shift is different, right?
Yes.
Okay, so you never know what's going to happen, really, apart from obviously the routine stuff, you know, getting patients their medications and stuff. Now, what do you go above and beyond your role as a patient? As a nurse.
As a nurse, yeah, right. Okay, above and beyond, sometimes there are some patients that they need that a little bit of comfort, extra care. They just want somebody to talk to.
Okay.
Yeah, because to let out themselves their frustration about their condition, or could be like an old patient who actually wants to go home, but the kids are not prepared to take them back. So it's just those kind of things. So sometimes for those patients, we need to spend an extra time, a few minutes, just to stand by, just listen to them and see how they go along about it.
Right. So you have to be therapists as well, and as you pointed out, Anthony, you have to be also like an IT specialist. Why do you say IT? Is it your network, your IT, or your patients?
Basically, a nursing profession is evolving. We are now going into the techno zone.
Yes.
So basically, we also have to deal with the computers. We have to deal with the Wi-Fi's, the phones, and everything that's new now.
Okay.
The gadgets. So at times it may crash down unknown times. So
okay, so you have to deal with that.
We have to deal with
now, someone wrote about, you know, what would I have known, what I wish someone told me before I became a nurse, right? So is there any part in your profession that you wish someone told you about? Nora Amelia?
Well,
before you kind of launch yourself into the job?
Maybe.
Any surprising things, Jasmina?
Yes, what I wish someone told me about is the long working hours sometimes. I actually start at 7 in the morning and I finish at 2, but actually it drags on till the 5.
Okay.
Yeah, sometimes. Yeah,
right.
Because it's not just the working sector, but it's also sometimes the extra time you need to spend with our patients.
Okay.
The work, the computer work, the paperwork that we need to do, get it done.
Right.
The doctors that come at the odd hours and then while our colleagues are taking over, so we have to follow and finish it.
Right,
so
right. Now, obviously also you deal with different issues. One of it, obviously, one nurse actually said on this article that, you know, you tend to develop sometimes attachments to the patient because you care for them and you see them quite often with some patients. So there's an emotional connection, and sometimes it's difficult when the patient leaves or when the patient dies. So have you encountered anything like that before?
Yeah, I do. Like, you know, I work in the neonatal ICU. We have premature babies coming in, and when they come in, they are so fragile, so dependent on the machine to support them to breathe, to breathe and to grow. And as the days go on, you are seeing them growing, and it's just like they are just part of us. We are like their mummies, taking care of them, feeding them, and sometimes when they cry, we will sense it. What is their discomfort already, or probably it's the nappy. Certain baby cry for certain things that we can sort of like read them already. So we really grow the attachment with them, and even with their parents.
Okay. And how about the difficult issue of someone dying? I mean, how, for you as a nurse, this is your job. You go in and you're doing the hours. But that emotional connection and having to get away from it or deal with it, Anton?
This is the art of nursing, I would say. Being a nurse is tough. Dealing with emotions, and of course, like we're saying, those that are dying. But this is what makes a nurse strong, right?
Does it affect your life? I mean, how do you personally counter it?
Yeah, it does affect me at times.
Yeah.
If you're really attached to a patient, of course, you will always put them as your brothers and sisters. That when you're caring for them, there may be your parents. So yes, I would say that it affects me a lot. And at times, you go back after your shifts, and I think all the nurses will agree to this. I mean, we would go home and sometimes sit and think about, what have we done for our patients, and is he going to be good or is he going to be bad? Yes.
Okay. What about health hazards? For you, all of you are from different departments, mostly. For Jastrina, in cardiac ward, what is it like for your job as a nurse that could differ from a nurse from another ward?
Okay, like my ward is more specific because we deal with the heart, so we are very we are more precise about everything, the care about the patient from head to toe. For instance, in a surgical ward, they are only worried about the bleeding or the wounds and everything. So I would say ours is in a whole compared to Emilia is from a mixed ward, so I think Emilia will have more things to say about her.
Yeah. What's your ward like, Emilia?
Well, my ward encounter with mix of cases. We're dealing with medical, surgical, and also gynae. Sometimes pediatric also we do encounter with. As if for me, nowadays we got a lot of dengue, so we have to watch for danger sign of dengue. And when patient go for operation, we have to look out for the dressing to make sure that there's no further bleeding, stuff. And for pediatrics, we try, even though they cannot express their feeling, so we have to understand them, give them comfort. Babies, they cannot speak too much, so yeah, that's about it.
Okay, all right. So in different wards, obviously, you have different challenges. And for you, Andrea, it's neonatal, so it's more babies.
Yeah.
Okay, all right. Yeah. And now, people ask, you chose a profession to be a nurse, right? Why not a doctor? Has it any kind of crossed your mind, or is it just that's what you wanted to do? Jastrina?
No, I always wanted to be a doctor.
You did?
Yeah, I always wanted to be a doctor.
Okay.
As far as I think when I was studying, I always wanted to be a doctor. Then after that, I thought, okay, now my nursing, since I've merged into nursing, so I'm like, okay, now my nursing is fine. So when I went to it, I started learning it, the knowledge level. It's bits and parts of everything actually. It's something like a doctor as well, but we have got an extra, I would say, a soft spot. We have got an extra caring part. Like doctors, they just come see patient, yes, okay, they tell you what to do, what to carry out. But our is the art, how much we can spend with the patient. Our touch counts to the patient. Just by us comforting, giving them a rub, it makes them feel wonderful.
So our society has been stereotyping. I mean, why not ask the question, why not be a nurse than a doctor?
Doctor, yeah.
Yes. No, definitely. These are questions like people are obviously, out of fun, out of humor.
Yeah.
So now the other part is that where do you see yourself progressing? I mean, some nurses, this is a lifelong job, or for some, you choose to go into training or teaching.
Right.
For you, is there like a progression that you think of, that you're just very happy where you are? Andrea?
For myself, now I've been 19 years in nursing, so I've progressed to the current as a nurse manager. So yes, in nursing is a lifelong education. We have to keep on update ourselves with the knowledge and the skills. And I really hope that I can pass it down to my teams. It's just not growing alone, but I want to see my team growing together. This is a nursing profession.
Yeah, because the medical industry is always finding
changing,
new medical knowledge, new technology, right? And Amelia, for yourself, I mean, progression-wise, or is that, you're just happy? How many years have you been in this job?
I've been like about almost 3 years.
Almost 3. So would you say that you're pretty new, or is it's kind of established now?
Kind of established, because we kind of the skills is improving, even though like we are new.
Yes.
But still, our knowledge, we have to improve our knowledge day by day. And some more, like for me, I'm mixed ward. So I have to know each and every cases, know what education that you will give to patient, different diagnosis, different kind of education. So you have to educate yourself and also to your patient as well.
I see. All right. Jasrina, any part that you want to go from here?
Okay, like nursing is a very broad prospect. So obviously we can merge to teaching, we can merge to being in clinical while in the hospital and training our new staff. So it's quite good. You can go up to being a management team as well.
Right.
So yeah, I hope I will merge well to the management team.
To the management side.
Because I'm still at clinical, so it's my 5th year. So anything will go good for me.
Right. Yes. And Arden, I mean, you're working around so many women, right? I know this is part of a stereotype, but in reality, that's the case.
That's the case.
So what is it like for you? I mean, is it enjoyable?
As men, we have to be gentle. We have to be patient with all the women out there.
Patient.
I mean, during my college times, men have to share the toilet with the females as well. So I would say it's a pleasant journey.
It's a pleasant journey. Right.
Yeah.
I wonder why you say, we have to be patient. Why?
Well, women at times can be a bit cranky, but that's the reason why men's are here for.
Don't you get cranky as a male nurse?
I guess, but maybe lesser, I guess.
Okay, all right. Now, what would you hope that the public, would understand more about your job?
I would guess the public should know that actually being a male nurse is not all girly. A male nurse is still manly.
Okay.
Yes.
Right. In this society now, we call it the millennium. Men are expected to change diapers for their babies.
Yes.
Men are expected to feed their babies at 3 a.m.
Right.
as the females are doing. So I said that why not be a male nurse, and you have all the skills before being a dad.
Okay, that's very cool. So you're encouraging more men to join the profession.
Definitely.
Okay, and finally here, Andrea, is there any part here that, in conjunction with International Nurse Day, that you hope to convey to the public about your profession?
Yeah, nursing is actually a beautiful job, it covers all, because it's just not the knowledge that you gain, that you are working for, but also a knowledge for yourself and for your family. And as a nurse, you tend to be more stable emotionally, because you already got so many things that stress you, that you are sort of like well-versed, know how to handle the stressful events.
Right. And just what's the most valuable thing that you feel that you have really taken from this job?
Okay, this job, it teaches you to be everything under the sun.
Okay.
It's like a very good mom,
right?
A very good patient, because you understand how is it to nurse a patient, so you actually be very patient. and you actually be a very good daughter because you can look after your parents.
Okay.
And yeah, it's very good. It's very good.
Right, it's very good.
Very knowledgeable.
Very knowledgeable. So your time is very much spent wherever your workplace is.
Yes.
So, you know, is there any time to yourself, you feel?
There is, but sometimes, yeah, we do get caught up.
time.
Yeah, but we have to manage it sometimes. Yeah,
Right.
we can. One thing good, we are flexible. We can ask for an extra day off sometimes. If
Okay.
there's the ward is a bit quiet,
Right.
then you know, yeah, our management is also very good. You know, they give us time off and everything. So that's the time you can plan and you know catch up with your things and stuff.
Right, right. And this is a job obviously not for everyone, right? Because it has to be
Yes.
for someone who is really has a calling towards
Yes,
the
correct.
job of wanting to
True.
give, right?
Yes, yes.
Now, Amelia, before we close up here, is there any shows or dramas that are medical profession that you feel like it's part of your favorite show?
Grey's Anatomy.
Grey's Anatomy. All right. Anybody share that same series
Definitely.
or?
I guess everybody loves
Yeah.
Grey's
Yeah,
Anatomy.
Grey's Anatomy.
Okay.
Yeah, we learn a lot as well from
Yeah.
there. You know, some
Yeah.
things are not learned from Malaysians' health industry. We get it from the outside.
That's it,
So
outside,
yeah, it's
yeah.
quite interesting.
Right. And is Nurse Jackie? I mean, does it correlate to what you do? That show?
Miss Jackie, I guess. Of course, I mean, we
way,
learn,
In a
we
way.
learn in a way from movies and dramas and series and all this.
Okay.
So
cool.
yeah, definitely.
That's very cool. And you watch it and you learn something as well,
Yes.
because
Yes.
obviously they have.
And we
left-
also question ourselves about the knowledge that we have.
Yeah.
Okay, do we do this? Do we do
Am
this?
I doing it right?
Yes, am I doing it right?
There you go.
So, yeah.
Thank you so much to all four of you for stopping by.
Thank
And
you.
once again, happy International Nurse Day.
Thank you, Lisa.
Thank you so much.
We are going to take a quick break, and when we come back, we have our camera following nurses to find out what day like in their job.
Nursing is a profession that can be both rewarding and challenging at the same time. Nurses play a very important role in the medical industry. Known for their most caring traits, nurses have now developed their own reputation and identity in the healthcare sector. While others can have a bad day at work, unreasonable requests from a boss, perhaps a mountain of work that never seems to shrink, for nurses, it involves life and death situations. For Karishma, a nurse in KPJ Selangor, despite all the mixed reviews and opinions heard while growing up, she has never diminished her dream to become a nurse.
Okay, I've been working here for 7 years because I'm from the background of nursing. Okay, both my parents are in the medical line, so yeah, I used to follow them during my young days to the hospital and see them working. I think nursing is a very caring profession. I feel I'm created to be.
For Araida, being a nurse allows her to meet different kinds of people from all walks of life, different characters and status, which not only improve her interpersonal communication skills, but also allows her to understand patients with different needs. One of the best experiences to date was to treat and take care of the Sultan Selangor during his stay at the hospital.
I care the patient, Sultan Selangor relative.
Amina, being a nurse for more than 16 years, has given her much experience in handling patients, the staff, as well as the management. She stressed that being a nurse requires not only the theory of handling patients, but also to be well prepared physically and mentally, as they will face demanding patients and family members to manage their expectation.
I'm starting career as a nurse since 1996 till now, first as a staff nurse, now as a unit manager. When we nurse a patient, definitely we have a patient with angry, anger, frustrated, and then with a family with having a lot of we call it grievances, which we have to deal day by day.
Meanwhile, in Subang Jaya Medical Centre, the nurses at the ICU are busy prepping to change duty between morning and afternoon shifts. Extra attention are required for these patients to ensure they'll get close 24-hour care due to their critical health conditions.
Yeah, I've been working in SJMC for the past 19 years. There was once a young man came in. He was not that bad, but he eventually turns very ill. He was ventilated, he was resuscitated, and praise God, he came out from all those And one day, he came back to visit us, and he was all well and back to his own normal life.
As the day goes by in the ward, there are moments when someone has to break the news, both good and bad. For these nurses, informing a loved one on the patient's condition is the hardest thing to do.
Working in ICU, of course, it's a bit of a challenge because we don't know, anything can happen at any time. So basically, it's a big world out there in ICU. Yes, of course. We would have patients that, of course, when they're deteriorating, some will be getting better and some will be, of course, getting down the hill. The worst one will be those that are going down the hill.
And that's how it feels to be a nurse. While most people are looking for a glamorous and high-paid job, these nurses choose to serve the community and strive for the best to save someone's life. They are among the important frontliners in healthcare. Some might forget their names, but we will never forget how they made us feel.